So arts and culture are fundamental to health. But you all know, just like I do, that we haven't yet integrated arts and culture into like our healthcare practices, or certainly not even into our general understanding of health. Like when you type health into your emoji search on your phone, you're not gonna come up with like a musical instrument or a novel or a dancing lady, right? You're gonna see the absence of disease. You're gonna see clinical care, like a stethoscope, doctor, pill. All of that is so important. And it is only one half of health. It's the absence half. We need that half. But there's a whole other half of health. How do we change up the fact that people's imagination around health is generally only focused on one half? How do we begin imagining otherwise? CMCB has been part of the Arts and Prescription Program here in Massachusetts, which is how I first encountered this fabulous organization. I want to make sure that you all get this free guide. If you haven't come across it yet, you can get it at, oh, this is for later, but tashagolden.com/CMCB. It's just my name.com/CMCB. You can download the guide there. I have a link for you. If you're not familiar with it, arts on prescription is exactly what it sounds like. Doctors, therapists, school counselors, social workers can prescribe or refer people to arts and culture and nature experiences in their community to benefit their health. And with the prescription, the experience is typically free. And we're seeing so many profound outcomes from this work that I'm happy to tell you more about, though I really encourage you to read about them and share them via this guide in particular, because it will do a really thorough job of giving you a big picture. The reason that I'm interested in arts on prescription and I've been leading research about this work, and the reason that I think it's a game changer, is because it's not just about making a cool new program in a community or at a hospital or clinic or school. It is a cool program. And it's also about altering norms and getting out of our bubbles and silos. It's a really concrete example of reimagining what we think health is, how and where we think it's created, and who we think is involved in the work. It's a concrete example of advancing health by actively integrating different sectors and industries, people realizing their relevance to each other. Once we decide we're not willing to be happy with just one half of health, that we're not willing to accept that health is merely, am I not sick? Am I not in pain? Once we decide that health is also well-being, we again affirm that we can't create it just with healthcare or just with the arts or with any single sector. We can only create it if we tap into all that humans know and can do across our various sectors and disciplines and industries, because we are whole people with whole community lives and needs.